now put into the laps of the Democratic legislature. What she's done is she knew that she was going to have to raise taxes, but she gave them an unbalanced budget and threw it into their laps and said, you're the ones that are come out saying taxes, because it's always going to be the Democrats that are going to do that. No, the Democrats are going to stand up and be honest with the people of the state. It's something she has never done. The fact is, she went in there and cut budgets. When she looked at cuts, she talked about the poorest in our state. She looked at the Kind Pace program for our seniors that have no money and they're on this program so they can get prescriptions. She's going to do asset testing for them. That's ridiculous. They need the medications to stay alive. If you want to look at what she wants to do with the Husky program, I was very fortunate when I first came into office 14 years ago. I got together a group of people from CCAG to CBIA, from hospitals to doctors to every group of people, to sit down and talk about what we should do about the uninsured. And we came up with a program that took care of children. We passed it on to the legislature. It wasn't in time for them to do anything, and the previous governor came out with a much better name, and it's called the Husky Plan. She wants to now make the poorest children in our state, pay a copay. Now, everybody's hurting. More and more people are going to come onto that program because people are losing jobs. Let's be realistic about it. Don't do what the Democrats in the Capitol, who understand and have feelings and understand what people really need. Don't give them false expectations. Be honest, come up with a true budget that will take care of the people of the state. She has not done that. She does have in her budget $5 million for marketing purposes, to tell you to please wash your hands during the flu season. Does she get it? No. You could have pulled that back. No, she didn't pull that back. She's still out there taking care of the flu. Because I have to believe that you knew to wash your hands by yourself. When we look at healthcare in the state, we have been fortunate enough we've started a program for pooling in the state, and pooling is very, very important. It is not a new concept, but it's a good concept. It's the right concept to bring together people and get them so we can lower costs. We started a media program that has some of our small businesses and not-for-profits in it, but it's going to take us a while. We've got to make sure, and I've been working with the Speaker of the House to get the right wording in so that we can find ways of cutting the cost of health care. I have a bill in now that talks about transparency of healthcare data. Right now, our small businesses, our small municipalities do not get the data they need to negotiate with the insurance companies to find out exactly how much they're really costing. So they can't get the data or claims data because they don't give it to them. It's time to fight the big insurance companies. It's time for giving the right knowledge to all the people so that they can go out there and cut the cost of health care. These are the things that are going to keep us going for a very long time. I was just listening to one on NPR, and they're saying, and everybody's saying, well, why is Barack Obama taking everything on all at one time? I want to tell you, thank God he is, because it is the economy, it is health care that is causing all these problems. And we at the state level and at the national level have got to work together. And I've got to tell you, we have the best, I believe, the best U.S. congressman in this district. Courtney has been incredible. Joe Courtney, I was on the phone with him this week and calling into Washington about the stabilization fund. He is right on it, and he is out there pushing for it. The money that we have gotten into the state and what we're getting for education and health care, Joe is really out there. And Joe didn't vote for that first package because he didn't think that was right. This one is right, and he voted for it. And I want to tell you that we've got to make sure our legislators and all of us keep an eye on what this governor is going to do with that money, because the money is supposed to be going back to the cities and towns. It's supposed to be going to help health care, help our children, and we've got to make sure that it gets done. And you're right, we do need a vision. And we need a vision for now and for the future. And I thank you and I can't wait to answer any questions.